You having a good day today?
Yes, what about yourself?
Great, I'm having a wonderful day.
Great.
Okay, we're going to get started here. Okay, Ms. Creek. I have already reviewed your resume, and everything looks good. I have a few questions to ask you.
Okay.
Can you go ahead and tell me a little bit about yourself?
Okay. I graduated from HCC Coleman this past semester for my RN. I'm currently looking for an ER job at the moment because that's what I specified. I am not really concerned on whether I work days or nights. So that's kind of up in the air right now. I can work days or nights, whichever one I need to work. And I'm a hard worker and very determined.
Okay. Can you explain to me what led you here to St. Luke's and why you're interested in working here?
Because the environment here is very nice. I like the people that work here. It's very organized. The people are all very educated in what field they're doing, and it doesn't seem like anybody is kind of lost in what they're trying to do. So I like the fact that people here know what they're doing, and they're all nice to each other. They work well together.
Okay. Can you let me know exactly what position would you like to work here at the hospital?
Excuse me.
The position.
The position? I'm looking for an RN job in the emergency room. I like the high-paced environment. I like being able to have to work quick and fast. I'm good on my feet. I'm very good under stressful situations, so I would prefer to work in the emergency room.
Okay. So can you describe a previous work situation in which you had to deal with a high-stress situation?
Yes. Before I went to school for my nursing, I worked as a district manager for a distribution company. And it was very high stress because if the customer didn't get what they wanted when they wanted it, people would yell and fight, and I would have to come in and have to kind of separate. Yes, kind of separate, and it was pretty much up in the air every day. You could lose clients, or you could gain another one, or it was very stressful going from one client to the next.
Okay, so overall you can handle high stress environments without a problem.
Yes.
So your emergency room would be ideal for you.
Yes.
Is there a situation where you may be able to work in emergency situations in the neonatal department?
Yes.
Okay. I noticed here on your resume you didn't really list any information where you've had any maybe training or you work for volunteer work here at any hospital. Do you have any of that information at home maybe?
I do have that information. I just but yes, I did do volunteer work at Memorial Hermann for a year while I was doing my clinicals at HCC.
Okay. Can you give me a reason why you may have left your last position at your last job?
My last job, the reason why I left it was I saved up enough money to where I could go back to school, to do nursing school. And me and my children moved to Houston so I could go to school here and finish my schooling here, because that was my main goal, was nursing school.
Okay. Can you describe something that's an ideal work environment for yourself?
An ideal work environment for us. I like to work with people as a team, but I also like it whenever people trust me to work on my own as well. I like both situations, but in a high stress environment like the ER, you're going to be expected to work by yourself at certain times, even though the doctors and nurses and everything else will assist, of course, and we will assist other doctors and nurses, but I like being able to know that I can work on my own as well as with a team, with people getting along fine and being knowledgeable, and everybody knows what they're doing, and nobody's lost, I guess.
If there's a situation, you come into the hospital and it's your shift time and an emergency happens in the neonatal department, and say for instance 3 nurses didn't show up for their job duties on time that day, what would you do in that case?
In that case, I would put myself into the situation that they were supposed to be there for. I would go ahead and step in and take over their responsibilities until somebody else came in and was able to help me. I would try to divide my time equally with their patients or the emergency or anything else, along with the job that I was previously doing.
Here at the hospital, just, FYI for you, if that situation happens and occurs, we do have a shift work list of nurses that you can call at that time. Even though there's an emergency situation going on, there will be enough people on staff to start the emergency preparation, and you can be able to go to that list and pick from that list and call a few nurses.
Okay, great.
Why would you choose St. Luke's Hospital over all the other hospitals in the medical center?
I've heard great things about St. Luke's. Their hospital, of course, is gorgeous. The hospital is very nice. The people who work here, they say great things about the hospital. They have great benefits. They like the people they work with, the doctors that they work with. There's not very many issues with employees, and I think it would be a great environment for me to work in.
Can you tell me one notable accomplishment that you may have made that stands out for you?
Finishing school while being a single mom of 2.
Yes,
That
is a great accomplishment.
That's one of my favorites.
Okay. Okay, there is, okay, here I can explain to you what St. Luke's provide here in the hospital for you. Let me just actually let you know what we need here at the hospital. We need a person that provides great patient care in compliance with the St. Luke's Hospital policies and procedures and standards of professional nursing practice. Also someone who can work 12-hour shifts or longer if needed, and someone that can be on call at any time. And of course, like you said, you work under pressure very well, and that's fine. We would need that at a hospital most times. And someone that can work under minimal supervision. Okay, and you seem to be able to. Yes. Also, there were also some things I wanted to tell you about the salary. Our salary range actually starts at $68,000 for the RNs. We also offer benefits of dental, life, vision, and paid time off, retirement benefits, and we assist you with any education that you may want to continue in your field of work. We have reimbursement, financial reimbursement, okay? A couple of things I had wanted to mention to you. I looked over your resume as well. I noticed that you didn't also add here your certifications for like CPR and things of that nature. If you can get those faxed to me or stop by the office and anything next week and bring them, I really need to get those in your file. Okay. Because there will be a second interview. I really like your resume here, and you have the qualification. And I noticed here that you have a lot of computer skills, which is very needed when you're doing front office. Okay. Okay. You have any questions?
Yes, I do actually. When would I be able to start?
After you are contacted with the second interview, then at that time we will give you the exact salary package, and you can accept or decline. That will be up to you, and we will let you know what the start date will be.
Okay.
We will be contacting you within a week.
Oh, okay, that's great.
And that would be definitely, that's why I say you need to fax it as soon as possible. with your certification.
Okay,
Okay?
and,
So when you take the second interview, then we will go ahead and give you the information based on taking your analysis and things of that nature.
okay.
Any other questions?
As far as vaccinations, whenever you go into the nursing program, I know they need to have all your vaccinations. Do I need to have any more vaccinations or anything else whenever going into this?
All of that is part of the information that I want you to fax me for the
Okay.
certification, your vaccine.
Okay. And as a follow-up, if I don't hear from you within a week, what would you?
You are more than welcome to email me any questions
Okay.
of your certification.
Okay.
Okay?
Okay.
Thank you so much.
Thank you so much.
Okay, thank you.